Hello, my name is Christina Jones, and I will be discussing antibiotic resistance, specifically how it occurs and how medicine will change as a result. So first we must establish how antibiotics work. Antibiotics, in essence, either weaken microbes or prevent them from replicating. In both cases, this ends in eradication of the pathogen. Some, like penicillin, inhibit the growth of cell walls, making it much more difficult for pathogenic microbes to protect themselves from foreign chemicals or immune responses. In the same way, some actively injure the cell membranes of cells, ripping or dissolving the membrane until it is effectively lysed, or at least enough. Again, others prevent reproduction in the form of halting replication, meaning sexual or asexual reproduction is impossible. Additionally, the production of mRNA and proteins can be prevented, keeping pathogens from adapting, protecting themselves, or even in some cases, eating. In any case, the result is the same, diminishing population, but the method of which varies: starvation, infertility, lysation, or immune response. But how do cells become resistant to antibiotics? For this section, I'll be using a common example of resistant strains, Staphylococcus aureus. In many cases, a non-silent mutation is required that allows for this protection. At that point, only those cells with this immunity will survive, and then from there they will reproduce, making it much harder to kill. Alternatively, transfer of resistance, whether by conjugation, a sexual form of reproduction, or transformation, an asexual form of reproduction, provide the opportunity for cells to receive plasmids containing the immune genes. Mutations can occur along this process as well. So spontaneous mutations of immunity are another factor to consider when discussing the rate at which resistance is developed. There are several types of resistances to antibiotics, the first of which being enzymatic destruction. If S. aureus can create an enzyme capable of eroding the chemicals in a pharmaceutical, it can prevent the absorption of the antibiotic and thus protect itself from the adverse effects. This would require an immune response from the cell. There is also prevention of penetration, usually in the case of gram-negative bacteria that have cell walls, as they are more effective at preventing the flow of unwanted molecules than simply a gram-positive selective cell membrane. Think of it kind of like a brick wall with a small hole in it versus a net, and you're trying to throw a rock through it. Alteration of binding sites is also a common approach, involving changing the binding site's chemical properties or shape in order to prevent adhesion of the antibiotic's active ingredients. Also possible is rapid ejection out of the cell using proteins generated by the cells. According to the World Health Organization, individuals aid the development of resistance by the following: improperly preparing food or lack of proper hygiene, such as eating raw or rotten food or not washing your hands. This can introduce pathogens to the body, allowing for immune system response. If this occurs, it is possible the pathogen will become resistant to human immune responses and ultimately require antibiotics. This in turn, if used improperly, like not finishing a course of antibiotics, can lead to resistant infections. On the medical level, doctors are responsible for providing patients with the correct amount and type of medication. If a doctor gives unnecessary medications, even if at the urging of a patient, it is still their responsibility and could result in a resistant strain. If a patient develops a resistant strain, it is also possible a doctor wouldn't report this to the appropriate authorities. This in turn would make it likely that a bacterial infection could spread, creating a higher risk to potential patients. In agriculture, it is common practice to utilize antibiotics for extended growth of livestock. This is used for larger cuts of meat, such as chicken breast. However, it also has a similar effect to human overuse and therefore is dangerous for potential resistant infections. This can also spread to humans. Other common issues is the lack of vaccination, which would prevent much of the need for antibiotics in many cases, limiting the speed at which resistance develops. Finally, why is this an issue? Well, as drugs become less and less effective, more expensive drugs have to be developed and won't be as widely available. This increases the risk of mortality and overall increases the recovery time for many conditions, making care much, much more expensive.